lots of really great questions that have come through, and Ali was earlier on kind of pushing me along. Just sort of one key question that threads through some of the other questions that have come through, which is the NHS has legislated for integration, the ICB and the ICS structure. That's the latest reform, and in one sense, Harv has already talked about this. It's become more remote as a potential challenge. How I would argue that the idea is that they've legislated for collaboration rather than competition. How does the panel kind of think through the idea of taking advantage of this rather than dismissing the opportunity that comes with integration? Because you come from different shapes, from the community, from a single organization, from a council, through to a single provider. How do we do that? If I start with Arif, who perhaps sits just beyond, just outside direct healthcare areas.
Yeah, thanks, Nadeem. I think, we had place-based organizations previously where we were doing the sort of integration. And I think we had Blackpool CCG and Blackpool PCT, and I work in a place-based organisation, the local authority. So it's not as if we weren't doing integration then when we had those organisations. Yet we were doing those integrations. I've worked as a DPH in the NHS and in local government, so I came across from the PCT into local government. And one of the things I noticed straight away moving from the NHS culture into local government culture was that I was far more visible, far more connected to communities, far more connected to my voluntary sector sat in local government, far more accessible to the population, working with my councillors and my elected leadership in that political arena. Meant that I could get lots of things done, which I didn't have levers for when I was in the NHS. So I think working with a local government organisation is really important. And this is where I felt the challenge with an ICB, which is so far remote from me and my organisation at a local level. And what we're starting to do now within the ICB is to create those place-based structures which we had previously. So we've gone round full circle. We are talking about place and place-based approaches. But the frustration from my point of view was, we had those things previously. If it wasn't working 100%, then we could have maybe tinkered with it on the margins rather than had this wholesale reorganization. Integration is really important. Integration is what we need to do, but people often talk a good game and actually don't do it on the ground. I think what we've talked about today is actually practically delivering that integration across all sectors, working with our communities. And it's about working with our communities and understanding our communities and understanding what works for our communities if we're going to make a change and get those inequalities reduced.
Great, thanks. I'm going to be a bit rude and just cut through to what I was asked to ask each of you to share, if I might. We've had lots of questions. We've talked about integration and the challenges that come with it. Can each of you summarize in one sentence what the audience who's been with us now through the webinar could take away as a way of an action they might think about taking from your perspective? What do you think they might want to be able to do, where they might go to kind of get things done rather than to set out the idea of more structure, the idea of more aspirational strategy, but more about action? So if I go around the room, if I start with Maggie and then work my way around for that, because I'm going to have to close on time. I can't extend the time.
So Nadeem, what I would say is that people who are in senior positions, it's about knowing your workforce, be curious about your workforce, find out from your workforce what will really matter and what you can supply for them, and put your support into those matters. Continue to recruit from your local areas. Do everything that you can to recruit from your local areas. Every pound that you spend locally will help break that cycle. So it's not good enough just to look elsewhere and outside of your immediate vicinities. So yeah, for boards, they need to be really curious about how they can be a real partner in health inequalities and the regeneration that's required.
Thank you, Maggie. that points to the Preston model. More on that one day. Samira.
Yeah, so I suppose one of the key things is it's more an invitation to be a participant in the conversations that happen in your communities and at neighborhood level. I think it's good if we can suspend the agendas that we are trying to actually kind of impact and influence within our system and just be present and participant in the reality of people's lives. Then that helps us. If we start with a conversation, please don't start with a plan or a strategy. If you start with a conversation, the plans and strategies are really important, but they'll come later.
Great, thank you for that perspective from a community position. Hajit, you're on mute.
I mean, it's just really about, as others have said, being relentlessly curious and listening. I mean, everything that Samira and Maggie and Arif said resonate. When I talk about structures, I'm talking about community partnership. I'm talking about leaning into place, being helpful, engaging as an anchor organization, huge capacity to impact. So all of this in a joined up way is what integration is all about. And even if it's been invented before, it's our turn to reinvent it again in the interests of the people we serve.
Fantastic, thanks. So it may seem old, but actually it may be renewed and refreshed and have a different perspective. And Arif, if I could turn to you.
Yeah, thanks, Nadeem. I think it's that person-centered approach that Samira was talking about, making sure that we are meeting, the needs of the individual. And to do that properly and to do integration properly, we shouldn't have to leave integration for the individual to do. We as agencies should do that integration for the individual so we get the right intervention for that individual. So regardless of which service they end up with, we should be thinking about the person in the most holistic way and getting the right intervention for them and understanding what their needs are so that we address those needs rather than looking at it from a professional perspective of meeting a clinical need.
Actually, that's a fantastic final thing to pick up then, which is what, if we don't understand the needs of the citizen, the patient, the family, then we're failing fundamentally as professionals. And the idea of silos coming in the way is partly reflecting the professional need rather than the needs of the citizen and the population. Thank you for that. So I'd like to thank all our speakers. Thank you for fantastic sharing and fantastic perspectives. This is obviously going to be available for others that couldn't make it to pick up at a time that's convenient for them. I would like to just, for those that are with us and who are listening later, if you want to learn more about what we do and how we do it, subscribe to our newsletter, which lands in your inbox every quarter. That would be a good way to understand this idea and other ideas that relate to inequalities. We have our next webinar, which is on the 3rd of December, which is, as you can see here, revolutionizing healthcare decision making through data innovation. Remember at the beginning I said we're really a analytics organization at our core, and we love to use data and insights to help the idea of thinking differently in an evidence-based approach. If you'd like to get in touch to know more about this and more about what we do, then you have ways of doing that either through our website, through the email of events@stratis.uk, or you can hunt me out on LinkedIn, where I'm known as the man with the hat, which I'm not obviously wearing today. So I'd like to close by thanking everybody for attending, and thank you to the speakers. And I wish you all a very good day and look forward to connecting with you through this and other works that we do through the organization. Take care, everybody.